If you have frozen shoulder and want to relieve your pain and even increase your range of motion in as little as 6 minutes a day, then stick with me until the end because I'm going to show you the best treatment that you can do at home. And no, there will be no exercises or stretches involved. Adam here from trainingmassage.com. Now I'm sure you're wondering what that treatment is if it's not stretches or exercises. And the answer is to perform self-massage techniques on these 6 different muscles that I'll get to later on. But to get the best out of this treatment, it's best to understand what's going on in the first place and how self-massage can help. To keep it simple, when you have frozen shoulder, that simply means there's adhesions and scar tissue that form around the shoulder joint, which limit your mobility and can even create pain. Now, the normal way to fix this is to use stretches and exercises to help loosen the tissues, get the muscle stronger, and help increase blood flow. And even though this isn't wrong, and I do agree with it, this can take anywhere between 1 to 3 years before you see any good results. But being a sports massage therapist, I'm able to look at the body from a different angle, and instead of seeing muscles that need to be strengthened and need to be stretched, I see muscles and fascia that are tight and need to be released. You see, one of the most common problems overlooked by most doctors is something called trigger points and fascia restrictions. If you didn't know, there's a special connective tissue that wraps around your entire body, including your shoulder joint, called fascia. And normally this fascia system will actually build layers on top of each other in a nice and organized fashion that allows optimal movement. But if you stay in one position too often, like being on the computer or being on your phone for 8 to 10 hours a day, then that fascia line will not only follow that same pattern, but because there's no real movement in these muscles, it will then become disorganized, creating those knots or adhesions in those tissues. And if you haven't guessed yet, it's these adhesions that can create pain and limited mobility, just like frozen shoulder. In fact, according to this article from the Journal of Bodywork and Movement Therapies, therapists who used IASTM on people with frozen shoulder was able to see results in as little as 2 weeks. Now, IASTM stands for Instrument-Assisted Soft Tissue Mobilization, and is basically a self-massage technique or a massage technique in order to help release the fascia. Now, there is another way how self-massage can help your frozen shoulder, and that is by getting rid of trigger points. Let's pretend for a moment that you're at the gym and you just got done performing 60 minutes of straight bicep curls, 20 different variations, we'll say, everything focused on the biceps. Well, think of a trigger point as a small little section in the muscle fibers that still thinks you're in that contracted state, even though you just got done working out. And what's crazy about these little bastards is that they can not only lock your muscle into a shortened position because that's the position they think they're in, but it can also create pain not only where it's at, but in different areas of the body. Now, later in today's treatment, I'm going to be showing you how to release the trigger points in 6 different muscles. But first, let's talk about one of these specific muscles that, if it gets full of trigger points, can mimic frozen shoulder. And that one muscle is the subscapularis. And the reason why this muscle stands out is because when it gets full of trigger points, it can actually create the same kind of pain and same kind of limited mobility as frozen shoulder. But you don't have to take my word for that, because we do have this one study that came to the conclusion that there is a strong association between the subscapularis trigger points and frozen shoulder. And conversely, the study also found that there was no association on the unaffected shoulder in frozen shoulder patients. But that's not all, because we also have this other study that shows by working on the trigger points within the subscapularis and the other muscles around the shoulder, patients with frozen shoulder were able to see results in less than 2 weeks. Now, of course, in this study, they used dry needling instead of self-massage in order to work these trigger points. But that doesn't mean you can't get similar results, which I'll be showing you how to do right now. And since we're already talking about the subscapularis, let's start off by releasing this one first. The subscapularis is located on the inside of the scapula, which means in order to locate it, you have to take your affected arm and pull it away from the body as far as you can, which is going to help pull that scapula out, allowing you to access the muscle. Now, to release this muscle, place your arm onto an elevated surface and then step away a little bit. This is going to help expose the scapula without having you to use your muscles. Now that the muscle is exposed, you can begin working on the muscle by using your other hand and reaching over to grab the muscle. From here, work on the most tender spot within the muscle by pinching and pulling on it to perform micro movements. Besides this, you can also perform a pin and stretch on that muscle by pinning the muscle down with your arm rotated in. Once you grab it, then you can then externally rotate it as far as you can to begin stripping the muscle and the fascia as well. Now, if you have trouble reaching over with your other hand, then we can also release this muscle by using the edge of a broomstick in order to jam in there basically and release this muscle, similar to how you would do it with your hand. Now, the next muscle you want to release is going to be the supraspinatus, which is the top rotator cuff muscle. And when this muscle becomes full of trigger points, not only can it resemble frozen shoulder, but trigger points in the supraspinatus are also very common with people who have shoulder impingement as well. Now, to release this muscle, locate the bony areas that stick out on top of the shoulder. From here, pull inwards towards the neck just a little bit until you're between the clavicle and the scapula. Now, use the massage cane to press into that area through the upper traps to begin hitting the tender areas for this muscle. From here, you can perform either micro movements like you did earlier by moving back and forth and side to side, or you can perform another pin and stretch. To perform a pin and stretch, start with your arm abducted, also known as going away from the body as far as you're able to get it. Now, from here, pin the muscle down with your tool as you slowly let the arm return back to its normal position, or even on an extra stretch by bringing your arm behind your back. The next muscle on the list is the infraspinatus. To locate this muscle, all you have to do is find the rear delts and work on that area to work on the underlying rotator cuff muscle, the infraspinatus. To work on this muscle, use a small ball on your rear delts up against the wall to pin down the most tender spots. Now, from here, perform some micro movements or a pin and stretch by starting with your arm externally rotated as you pin it down, and then rotate it inwards towards the body to help stretch it out as well as the fascia. Now, up next is the pec major and the anterior deltoids, which is very easy to locate. Anterior deltoids and your pec. And to work on these two muscles, I'm going to be playing with my brand new toy. And that one toy is a massage gun made by no other than Bob and Brad. Now, I do want to be clear here that they sent me this product for free to test out, but I am very happy about this because low-key I needed a new one to travel with. And the simple fact that they sent me this smaller version, which is just as strong as my bigger one, but about the same size as my smaller one, is a big benefit for me. And the reason why that's important to me specifically is because I use this a lot when I'm working with my clients where I'm actually communicating with them and I need to hear them, where they need to talk about tender areas, painfulness, what they're feeling, and those kind of situations. So the fact that this is a strong little beast that's also quiet helps me in 1,000 ways that I didn't even realize I needed. Maybe not 1,000, but definitely a lot that I didn't think about. So as my thank you to the Bob and Brad team, I'm going to be showing you how to release your pec major and your anterior deltoids with their brand new massage gun. If you want to check out this massage gun, then the link will be in the description below. To perform micro movements on either of these muscles, you can either use a flathead or a round ball with the massage gun on a medium to high frequency as you go back and forth and side to side on the most tender spots. Now, to perform a pin and stretch on the chest, start by placing your arm in front of you as much as you can and towards the inside of the body as you place your tool on the most tender spots. Now, pin the muscle down with your massage gun and bring your arm out to the side to begin stripping out that muscle. Now, to perform a pin and stretch on the anterior deltoids, start with your arm in flexion, basically your arm in front of you as much as you can. Now, from here, pin down the most tender spots and then pull your arm back into extension as far as you can take it. The next muscle you're going to want to release is going to be your lats, which is located on your back and to the side. To perform micro movements on this muscle, start off by using a foam roller either on the floor or against the wall to find the most tender spots, and then to move back and forth and side to side to begin flushing it out a little bit. Now, to perform a pin and stretch on this muscle, start off by pinning down the most tender spot with your arm in and toward the body. Now from here, go ahead and sweep your arm out to the side and up over your head as far as you can in order to perform a pin and stretch. Now if you worked on each of these muscles for roughly 1 to 2 minutes each day, then you should be able to see some good results in as little as 2 weeks. But there's a catch. You see, the whole point of these sun massage techniques is to not only help you relieve your pain as fast as possible, but also help you see an improvement in your mobility. But if you don't go back and perform those exercises your doctor gave you, then you run the high risk of this problem coming back in the near future. The idea here is to use these sun massage techniques to help loosen the tissues and relieve your pain as fast as you can, but then you need to go back and train those muscles and stretch them out to keep that pain from returning.